Apart from elevated blood sugar levels before or after a meal, type 2 diabetes, hypertension, and cholesterol abnormalities, as discussed in the previous section, there are numerous other conditions that are associated with a destructive metabolic cycle and the consequences thereof in the body. If you have any of these conditions, you are also at increased risk of developing diabetes, heart disease, or any other of the associated conditions. The destructive metabolic cycle is associated with an increased thickening and clotting of your blood, as well as a chronic low-grade inflammation in the veins. Hence, the increased risk for having a stroke or deep vein thrombosis. Growing skin tags in your neck, armpits, or under the breasts, sometimes referred to as mouse tits, remind one of overgrowth, don't they? Also velvety, mossy, flat wart-like, darkened changes in these areas. Stretch marks, especially in young people, or scar tissue, are also linked to insulin resistance. Turning grey before you are 40 years could also point to insulin resistance. Do you desperately want to fall pregnant and feel it is entirely your fault? This is not fair. Up to 50% of couples who cannot conceive within the first year of attempting is due to male infertility. Male infertility is strongly related to modern-day living. Polycystic ovary syndrome in women, also known as PCOS, is associated with localized insulin resistance. Insulin stimulates an overproduction of the male hormone androgen, which leads to male-like hair overgrowth on different parts of your body, such as your face, belly, or back, thinning of your hair, acne in your 30s or 40s, as well as infertility. You can now start to figure out that inflammatory conditions, such as osteoarthritis or rheumatoid arthritis, are also associated with the destructive metabolic cycle. Chronic pain induces insulin resistance. Fibromyalgia is often associated with complaints of gaining fat around the waistline. If you can relate to this, you are more prone to develop any of the diseases of lifestyle, such as diabetes. Have you been living with an irritable bowel for years now, never knowing when it's going to trigger? Irritable bowel syndrome, accompanied by pain, is also associated with the destructive metabolic cycle. You shouldn't therefore underestimate the possible consequences of your condition in the long run. Your snoring, associated with sleep-disordered breathing or sleep apnea, is not only keeping your spouse from sleeping, but is a well-recognized risk factor for heart disease and diabetes. You cannot forget the agony of a painful gout attack, can you? Oxidative stress and insulin resistance are often associated with high uric acid levels and gout attacks, as well as the risk of very painful uric acid kidney stones. Gallbladder diseases, along with gallstones, were used to be seen in overweight fair women over the age of 40. Today, we commonly see this problem in young adults, and this is also related to the destructive metabolic cycle associated with abundant modern-day living. Did your doctor ask you whether you have been drinking too much alcohol lately, since the results of your liver tests gave him that idea? This can be embarrassing, since the fatty liver associated with insulin resistance reminds one of the liver disease someone will get when alcohol is abused. It is referred to as non-alcoholic fatty liver disease, or often called a white liver. Have you slipped into a depression lately? Normal levels of insulin also affect the production of serotonin. This is the brain chemical that makes you feel good, controls your mood, as well as your emotions. People with insulin resistance probably produce less serotonin, hence the depressed feelings. Certain types of cancer, including breast and colon cancer, are associated with obesity-related inflammation and insulin resistance, and can be related to your previous lifestyle. Osteoporosis is often referred to as obesity of the bone. Fat is deposited into the bone and leads to inflammation of the bone, which can induce the development of diabetes. Sarcopenic obesity, or muscle loss obesity, is a subclass of obesity. Your body fat and muscle shift to more fat and less muscle, whilst your body weight on the scale remains the same. Aging, as well as a sedentary modern-day lifestyle, can lead to sarcopenic obesity, with the same consequences of an increased destructive metabolic cycle. Of late, type 2 diabetes has been linked to an increased risk for developing Alzheimer's disease. Vascular dementia is now known as type 3 diabetes. An increased formation of free radicals, oxidative stress, inflammation, and insulin resistance in the brain play an underlying role in the development of Alzheimer's disease. Many of the above-mentioned changes and nagging symptoms referred to in the previous section occur at or after menopause. The destructive metabolic cycle is therefore prevalent in many women after their menopause and could account for the diagnosis of any of the diseases of lifestyle after menopause. Do you want some good news yet again? You can slow down these changes and prevent a further downward spiral in your health and quality of life. I know this is possible because I've seen dramatic improvements in many clients with insulin resistance and the destructive metabolic cycle who have studied the information and followed the guidelines and strategies outlined in part 2 of this ebook series.